Introduction to Nursing Concepts, Medical Terminology. This is Martha Olson with the Mobility and Immobility Unit. As we look at para, it's used in many of the words for this unit. It's a prefix for beside, apart from, two parts of a pair, or abnormal. When you have somebody that has paralysis, it can be a weakness or an inability to use that part of the body. We think of a person that's a paraplegic, or they have paralysis to the upper lower part of the body, usually associated with like a spinal cord injury. Your parasympathetic division is part of the nervous system that is the rest and digest. Your parathyroid glands are located on the backside of the thyroid in the throat. And when you have a parathyroidectomy, ectomy always means to remove, so it would be removal of the parathyroid glands. The hormones are made in the parathyroid gland, and the parathyroid hormones help with calcium distribution in the body. When we look at movement, we often use ROM, or range of motion, which is the patient doing it themselves. Passive range of motion is the patient that has the inability to do the range of motion, and so the nurse, the physical therapist, the CNA will do passive range of motion, moving those joints through the ability, moving them so that they don't get a contracture. You have to be careful with passive range of motion that you don't overextend that joint or the muscles and cause injury to that. Activities of daily living. ADLs are things like eating, toileting, dressing, bathing, things that you learned in the CNA class and that you perform perhaps if you work as a CNA or as a nurse. We do many activities of daily living with our patients or clients on a regular basis. IADLs are instrumental activities of daily living. They're for the person that lives at home or more independently in the community. And it's things like managing money, shopping, being able to go to the grocery store and get the right amount of change out, or cooking for themselves. IADL sometimes when a person gets dementia and they're not able to function at home can be the indication that they're not safe, and we need to think about, perhaps getting them into an assisted living or long-term care facility. Hemi means one half. When you have hemiplegia, it is a paralysis of half the body, usually after a stroke. Hemiparesis then is the weakness that goes along with that. And then hemisphere is another hemi word that we think of the world, like in the northern hemisphere, and sphere actually means ball. ISO is an abbreviation we use with exercises or isometric resistance exercises. That would be like your Kegels, where you aren't really moving the muscle except you're tightening the muscle. We use isometric exercises with a lot of patients that have had like below or above the knee amputation. And an isotonic muscle contraction, again, is tightening of the muscle without moving the limb or the extremity. Atrophy is to lose muscle. We think of muscle atrophy if you've had your leg in a cast all summer, or if you don't use the muscle, they do get smaller or shrink in size. A is without. That's a very commonly seen prefix. And then trophy is the process of development. So when you have muscle atrophy, it's weakening of that. And from the picture, you can see the one leg on the right looks or appears to have atrophy. Osteo means bone, and we have many, many words that go with the immobility unit that have osteo in them. Patients with osteoarthritis or painful movement from their joints. We have osteoblasts in class that you had in your biology classes that mean to build up or to break down those bones. When we have an osteoma, oma means tumor, so it's a bone tumor. Osteopathy, pathy is condition of, so it's a condition of the bone. Osteosarcoma is a condition of a cancerous type of oma or tumor in the bone. And then osteoporosis we see very commonly in our older adults, and it's typically more commonly seen in females after menopause, but that doesn't mean that elderly men don't have osteoporosis. We do a DEXA scan. We have lots of nutrition teaching to prevent a person from getting osteoporosis, and we know if they have osteoporosis, they have a much higher risk of having a fracture. As we look at fractures, when you have a pathological fracture, it's usually a broken bone caused by a disease. So if I have a disease process that's pulling all the calcium out of the bone, maybe an endocrine disorder, you can see a person getting a pathological fracture. And then listed on the picture are just the different types of fractures that we have, like a spiral or a oblique, transverse, different types of fractures you may see written about in the immobility unit. When we have clots, we have a thrombus and we have an embolus. Embolus is a traveling blood clot, and a thrombus is a clot that's stationary. We typically think of a thrombus in the lower extremity or in the calf area, possibly from bed rest or sitting on an airplane too long without getting up and moving. An embolus becomes very concerning because it can travel to the lungs, and as you see the picture of the lungs and heart there, it can become a PE or a pulmonary embolism, causing problems with difficulty breathing and oxygenation as a result of that clot. Dia means through, and so when we look at diastolic, we know that that is part of that blood pressure we get with a sphygmomanometer. Systolic is that top number, and it's the pressure exerted on the vessel when the heart's contracting. And your diastolic is the opposite, it's the relaxation. The systolic is that first number you hear when you take a blood pressure, or that Korsakoff sound, and your diastolic is the ending sound that you hear and when you take a blood pressure, and the terms came from the site that's listed. To move something is to abduct or adduct, and that's a real easy one to miss on a test because they look very close with just one letter different. When you adduct, you bring something closer to the body, and when you abduct, you take it further away from the body. Where we see this a lot is when somebody has a total hip replacement and we have to put an abductor pillow between their legs or abduct that hip so that it does not come out of its new socket. And so you will oftentimes see an abductor pillow used post-surgically for your total hip replacement. SCDs stand for sequential compression device. This is used in your patient that perhaps is a post-surgical or on bed rest, and what it does is squeezes the lower extremity to promote venous circulation back to the heart. We know when we have a patient getting up and ambulating, they walk and the muscles squeeze, causing or forcing that blood through the veins back to the circulation. A person on bed rest, that blood tends to get very stagnant. So the SCDs squeeze the leg periodically to just give enough force into those veins to help prevent a blood clot or what we'd call a thrombus. Bi means two. So when we have bilateral pedal pulses, that means both of the pulses in the feet are palpable or you can feel them. The child on the right has a bilateral cleft palate. You can see that both sides of the nares are affected by that congenital malformation. So bi means two. If you ride a bicycle, you have two tires, and we often see this used in many of the terms in healthcare. This is the mobility and immobility unit. I hope it's been helpful in your study and prepare for this unit. Have a great day. Thanks.